Basically, I've been developing this memory enhancement program for the last 3 years. And we have a piece of machinery that helps out, and then me, along with my students, for the last 3 years have developed a database that I feel is very helpful in evaluating somebody's potential for memory decline later on in life. So I'll ask this question a little different than I did last time, but what's the 2 worst diagnoses anybody can get? You got terminal cancer and any kind of dementia. Because at this current day and time, it's irreversible. So, you know, Alzheimer is a type of dementia. So 60 to 80% of the cases, however, are Alzheimer's. And obviously you got a neurodegenerative disease that destroys memory and thinking to the point where functioning gets less and less and degrades to the point of a very sick person. And it's progressive and irreversible. The sad news at this time is that, I kind of belabored on this too much last time, but a little known neuroscientist at Vanderbilt University, Dr. Schrag, started looking into the beta amyloid studies that were done by the University of Minnesota doctors, Dr. Ash and Dr. Lesnay. And he started questioning it, and he started doing his own research at home, not at Vanderbilt, but at home with an old crusty microscope. And he started looking into it. Anyway, this was just this past, like a year ago when he was doing this. And so when he started looking at the DNA images, and everybody's seen do you want to go one more? That's a DNA image. He started looking at them, and they had cut and pasted 20 different times on DNA, just like you and I would for a picture. And so he questioned, I didn't realize this until I came across this, there's PubPeer. So if you disagree with any kind of finding, you publish it on PubPeer. So then all these Alzheimer experts and dementia experts around the country, of course, jumped on that saying, oh my gosh, how dare this guy do this? And they started looking at it and they were like, oh, he's right. So even Dr. Wilcock at the University of Kentucky, she even made the statement in commenting about this, it held up her studies and her research because she thought she was doing something wrong because she could never reproduce what they did. So best estimation, it has set back research on Alzheimer's 16 years, and just this year alone, $1.6 billion has been spent on that study, on findings of that study. So NIH has wasted billions of dollars chasing a rabbit hole that's just not there. Getting into the different types of dementia, Alzheimer's already talked about, 60 to 80%. All of us, you know, whether it's some kind of entanglement in the brain, some kind of protein buildup, that's to be proven. And the things that we cannot control, we can't control age, we can't control family history, and we can't control genetics. But I will tell you this, there were 9 biomarkers that have been studied to help predict Alzheimer's or some type of dementia. And in case you missed it around Thanksgiving, popular actor Chris Hemsworth said he's going to take time off because he's got the ApoE4 gene and he wants to spend more time with his family. Now, I don't disagree with the fact he needs to spend more time with his family. However, the people who have one of those ApoE4 genes in the study that is most prevalent, there's only 56% of the people that have that one gene. He has 2 ApoE4 alleles, which is a genetic term, and only 11% of the people with Alzheimer's has that. So that means there's 89% of the people out there that have the same genes combination he's got that didn't develop Alzheimer's. So he's being given improper data by some doctor, and I'll argue with him forever because I've done a ton of research. There is one biomarker that was identified by Eli Lilly in July 28th of 2020, and it was released into the Journal of American Medicine. And I finally found out today, after doing more research, they're not sitting on that research. They are trying to make sure that it produces the same results across a broader spectrum of people and diversity of people, male to female, different races, different body types. But in its release to JAMA, which is the Journal of American Medicine, they announced that it could be a 20-year predictor of Alzheimer's. So there is hope with that, and it's called the p-tau217 gene, or biomarker, and that's some good news. And it was also good to hear that they're really trying to fine-tune it and see how it can finally be used clinically. My main message today should have led with this, is that memory decline is preventable. It's not inevitable. You can do things about it. Even just like I'll get into my dad's, what I've done for therapy for him. Even somebody who's been diagnosed. I'll get into that later, but you can do things different, whether it's lifestyle, whether it's your drug therapy, whether it's maintaining, controlling your medical conditions. All those things fit into this. The other types that I'll mention, there's vascular dementia, which is, these risk factors. So, me having high blood pressure, and the older I get, I have more propensity to maybe develop vascular dementia. And that's where you just have problems recalling, forgetful. We all kind of go through that. But these diseases can definitely add to that risk factor of vascular dementia. And then Lewy body dementia, it's coupled with hallucinations, mostly male gender. You even change your posture, instability walking. And this was kind of a relief to, I guess, or to Robin Williams' family, is that, he did take his own life, but he also had, when they did the autopsy, he had Lewy body dementia. So, to me, that would give me a little bit of solace in knowing that he was probably hallucinating and a lot of just irrational thoughts. In my opinion, the worst type of dementia is the frontotemporal dementia. This is where you just basically lose your personality. You can't, you lose interest in your family members, you lose interest in your job, you don't care about anything but just doing what you want to do, and you don't act anything like you used to. And it progresses a little bit more aggressively than your typical Alzheimer's. 60 Minutes did a great feature on the leader of the Presbyterian Church in America, that she has this, and she has progressed to the point where obviously she had to step down. The next type would be Wernicke-Korsakoff syndrome. That's encephalopathy. It's really caused by lack of B1, and then a worsening of that is just the Korsakoff syndrome, where your learning skills, remembering things, all that just gets worse and worse. And then you have mixed dementia, where you can have any of these in any combination. Sometimes that's the explanation for why one Alzheimer patient's worse than another one, because they have mixed. So they may get combative, they may have one of the others that makes them hallucinate, and everything. And then other disorders related to dementia, just for mentioning, is Huntington's disease, traumatic brain injury, that's from a lot of athletes, and also soldiers who have been concussed a lot. And then the Creutzfeldt-Jakob disease, it's a rare form, but again, it usually appears after the age of 60. Parkinson's is usually associated with the Lewy body dementia because a really progressed Parkinson's disease, you do hallucinate. Our program that we've developed is based on 4 different evaluations. Behind you is our Cognivue machine, and it has one little joystick. This company's been in business for over a decade. They've been doing research, and I've worked with them. I've worked with them on my newest program. But the biggest thing it helps you do, it's kind of like me. With me having arthritis, I go to the rheumatologist and they get an x-ray of my back. And 10 years from now, they do another x-ray and they compare. So that's what that digital readout can help you do is, one, it can show you where you are now, and then by different things you can change with your life, then you can do another one to see if you're at least holding steady or have you improved. And there's a lot of times you can improve. And what it first of all does, it goes off of visuospatial memory. So I'm picking up my glasses here, I can see that instead of trying to pick them up here. That's part of your memory to be able to tell you where something's at. Also just memory recall, and then executive order. So taking commands and being able to follow those out. That's the first part of it, which is three parts of it. And the other 2 deal with speed, and that's your recall and then your processing speed. So your recall time and processing speed. And again, putting that together really helps to give you a good indication. It's kind of, it's not meant to compare to others. It's just meant to put you in an equal comparison with everybody in the database. And what got my attention is that my older brother and sister tested better than I did. And so here I am, with being the one that's overweight, being the one that lets stress get to them, all those things. And I'm like, okay, things need to change. So that's level 1 of our memory enhancement program, is just the Cognivue, but it tells you a lot, and you can do a lot based off of that. And then level 2 is the database that I've developed with my students over the last 3 years. They really helped me out with the statistical analysis to put all of the data together. But the first aspect that we look at is prescription medications. So there are 51 classes of drugs and 143 individual drugs that can cause memory loss. So that's the first evaluation that I look at, is look at the list of your medications and see if you are on one or more that could possibly be switched to another class of drug or another drug period. And there are some classes that have 3 or 4 drugs that contribute, and then another drug in the same class doesn't. There are those. So there's opportunities there to look and evaluate the medications. And the most prevalent ones are your benzodiazepines, such as alprazolam and diazepam, or Valium and Xanax. Your opioid pain relievers with your Norco or hydrocodone and oxycodone. Your sleep aids, so Zolpidem and Lunesta. Your synthetic hormones, Premarin and Provera. And then just about every oncology drug has memory loss as one of their side effects. And then just to mention a couple medications that improve your memory or chances of memory decline is your statins, because obviously it's increasing circulation, getting rid of your cholesterol and your fibrates, getting rid of lipids, again, increase in circulation, increase in cardiovascular flow, and then your bioidentical hormones. So what a male and female both, your naturally occurring estradiol, estriol, and progesterone. And 2 of those are available in prescription. Your prometrium is natural progesterone, and estrase or estradiol is your natural estrogen. But again, they actually help to decrease your chances of memory decline. On medical conditions, this is all about controlling your medical condition, doing something about your medical condition. If it is uncontrolled, then it's going to contribute to your memory decline so many fold, depending on the disease itself. And when you look at hearing loss, we noticed this with my dad, trying to get him to get his hearing aids, because we saw him trying to just draw back from the family. And we finally got him hearing aids, and we saw a big increase in his productivity and his just being a member of the family. But different, not to go through all the details, but severe hearing loss that's not either not correctable, or somebody just doesn't wear their hearing aids, it increases 5-fold chances of memory decline. Eyesight even, normal vision, baseline, no contribution to memory loss. But certainly somebody who just goes with poor vision, doesn't correct it, 4 times increased chance of memory decline. Congestive heart failure, you're controlled, not a problem. You are uncontrolled, you don't do what your doctor says, you don't try to watch what you eat, you don't try to get any exercise. Again, you're talking 4-fold increased risk of dementia. COPD, so getting into the breathing disorders. COPD, uncontrolled COPD can increase chances 1.74 times. Uncontrolled asthma can increase anywhere from 2 to 5 times. There's a lot of studies on uncontrolled asthma and memory loss, but it ranges in the variance of the contribution. Uncontrolled hypertension. So for every 10 millimeters of mercury that you're above systolic blood pressure, you have a 7% increase in poor cognitive function. So the message is just keep it under control. Then you have atrial fibrillation. And then that's the reason why they work so hard to convert people off of AFib, because it can increase your chances by 2.8 times. Autoimmune diseases such as rheumatoid arthritis or lupus can increase your chance 1.2 times. And there's not much we can really do about that. I try to keep my arthritis under control and those type things. And something I forgot to mention earlier, when you're talking about studies and percentages, just like with my form of arthritis, it's ankylosing spondylitis. 85% of the people with my form of arthritis have a positive biomarker for HLA-B27. So that's a diagnostic tool. 11% is not a diagnostic tool. So there are studies that will prove, hey, these biomarkers, if you got them, and just like even the other 15%, if they don't have ankylosing spondylitis, they have a greater chance of having some form of autoimmune disease. So having HLA-B27 is not good news. You can definitely develop various autoimmune diseases. The only disease that we had to leave out of our statistical analysis was Parkinson's. If we put it on the scale of 0 to 100, everything else would have been between 1 to 2 to 0, because it's so high in causing memory loss. So we still gave it a high score, but we put everything else on the scale to where we could score it out and show real. We just know that if somebody has Parkinson's, memory decline or loss is, you have a 50 to 80% chance having that disease. Diabetes, that A1C is king. You keep it below 6.5 and even below 7, you have a great chance of having no effect on memory loss. You get above that 7 mark, you start increasing your chances, and there's various studies on that, anywhere from 2.5-fold to 4.7-fold increase by not keeping your diabetes under control. And of course, that's just another thing. You know, if you don't keep your diabetes under control, you have a greater percent of lower extremity amputations. You've got a greater chance of neuropathic pain, greater chance of damaging your eyes. So that's just another bonus to keeping your diabetes in control and having that A1C correct. Oh, and of course, negative effect on your kidneys, because the next topic is having chronic kidney disease. There's 5 stages. So once you get above 3, increase chances of dementia by 52%. Depression and anxiety increases chances of dementia. Osteoporosis, increased risk of dementia. But again, you can kind of reverse that by getting those natural hormones, your progesterone and your estradiol back in there, because those things build bone. They also do the other beneficial things to your body, from tissue to mental health to a lot of things. So that's why there's such a benefit. So we've gone through 2 of the 3 factors. We've gone through the medications that somebody's on, their medical conditions and how well controlled they are, and then we got lifestyle choices. So tobacco use, obviously compared to somebody over the age of 75 even who was a smoker versus non-smoker, big difference. Even somebody, unfortunately, who had stopped smoking years and years ago, there's still an increased chance of memory loss, anybody who's ever smoked. Obviously, it's better than somebody who just continues to smoke, but there's still studies out there that show the chances are increased. Lack of exercise, especially in midlife and above. But exercise will reduce dementia risk by 30%, reduce Alzheimer's risk by 45%, and then it goes through, this one study even showed significantly whether it's moderate or intense exercise or even vigorous intensity, how much that benefit just keeps going up. Being overweight increases risk. Again, tons of studies on this, from 1.3 all the way up to 2 times. Your alcohol consumption of 14 drinks or better per week can contribute to memory loss. It's a 20 to 60%. Again, the range is there because of all the different studies we looked at, but 20 to 60% higher risk of dementia, even in a former drinker, than a long-term abstainer. So obviously that, I don't know where they started out with that key factor of 14 per week, I guess 2 per day. They went with that, and that's what the study revealed. The most interesting one I feel that kind of goes against what you would just think off the top of your head would be sleep. Less than 7 hours a night, if you average less than 7 hours prolonged, it can increase your chances by 50% to have decreased cognitive function. If you sleep average more than 9 hours, it increases your chances. So my dad, if my mom didn't get him up, he would sleep for 10 or 12 hours a day. Now he's already got Alzheimer's, but again, he does much better in that sweet spot between 7 and 9 hours. He'll get up, and even there's studies out there that morning sun, no matter if it's 20 below or 100 degrees outside, if you can get him outside and get that morning sun, how much better that helps out an Alzheimer patient. We do have the current treatments out there, the acetylcholinesterase inhibitors. Donepezil is the most popular, Exelon and Remenil. What they do is they help to break down a substance, acetylcholine in the brain, it helps prevent the enzyme that breaks down the acetylcholine in the brain, so it increases levels of acetylcholine, which that's what your nerve endings need to transmit information across each nerve ending. So, and then the other type is memantine, and this, again, people who cannot tolerate the acetylcholinesterase inhibitors, and sometimes they cause severe nausea or loss of appetite, which sometimes is an Alzheimer patient is weakening because they just don't take in the calories that they normally do. But that's usually a problem with Alzheimer anyway. But certainly if you cut it off to where they have no appetite, you can't sustain that. So going to memantine really helps, especially somebody who can't tolerate. Memantine also helps out with Lewy body dementia better because and Parkinson's, because it does help with hallucinations. And what it does, it helps to, it balances the level of glutamate in the brain, which is an excitatory element in the brain. So by helping decrease that, it can help focus, it can help you keep under control, whereas if you have too much glutamate, it's just firing off all the time, and that's where the thought patterns and everything just get confused. So symptoms of too much glutamate, just to reiterate, is anxiety, depression, restlessness, inability to concentrate, headaches, insomnia, fatigue, and increased sensitivity to pain. The side effects of memantine, the main ones are headaches, dizziness, constipation, but they're usually only temporary. So it's more tolerated than the acetylcholinesterase inhibitors. Just to sum up everything, we have dementia there's been 50 million people around the world estimated to be diagnosed. That number in the current trend will be 152 million by 2050. 10 million new cases of dementia are diagnosed each year, so every 3 seconds somebody's diagnosed with some form of dementia. The biggest problem is that huge increase in new caregivers. It's put a strain on society, it's put a strain on families. Trying to get good sitters, because you want your mom or dad to stay at home because that's their wishes. And then sometimes even when they're in an institution, they're not watched as much as sometimes at home, and bad things happen, falls, breaking hips, those type things. So it's really put a huge crunch. The estimated cost of dementia is $1 trillion, and this amount is expected to double by 2030. Part of just looking at what this program entails for what I offer and Poole's Pharmacy Care offers, that test, the Cognivue, takes about 10 minutes to complete. It even gives you a little tutorial to start out with, and you go, and I've never had anybody complain. It's just, it really puts you through a mental exercise. The survey that I send out to get all of this data from you takes 25 minutes tops. And then I usually take about 3 to 4 hours of researching and looking at your, all these different things, evaluating your Cognivue result, looking at your current drug therapy, your current medical conditions, are they well controlled, and then looking at your lifestyle choices, because obviously part of those lifestyle choices would be to recommend a diet, especially if somebody really is struggling in recall or forgetting things, or just starting in the throes. Certainly going with a gluten-free diet or an anti-inflammatory diet. An anti-inflammatory diet is really giving up your red meats and even your all your processed foods. I have done that before, and it just goes to show you, willpower. My willpower is not that good. you know, with my arthritis, doing that anti-inflammatory and doing a gluten-free, you just feel so much better and you don't crave sweets. But that's the type of recommendations on just diet. So I go through, you know, all your lifestyle choices and make recommendations on that. And I just went ahead and brought 4 of the most prevalent ones that I recommend for people. The Vibrant Mind, I have a website on FullScript, fullscript.com, and I have 60 protocols on there for 60 different disease states. And that's where I found that product. It has the most documented ingredients to help out with memory. Luciplex, Union Springs started it out, it got sold, then they bought it back and they finally got another company to take it on. It's a really good product. That's the one that I take. It takes about 5 weeks to see a difference, but after that 5 weeks, I really could tell a difference. Interestingly enough, these last 2 are developed and owned by a pharmacist in Mississippi, the unhealthiest state, and we're right next to them. But the Superior Omega-3 was developed. I got to speak to the developer, and he's also the one that made Vasepa, which is the first prescription omega-3 fatty acid. And now you've got all kinds of generics out there. It's a esterified omega-3s. But anyway, he made Vasepa. And then he said, this is better than Vasepa because he perfected and added another step to this one. And omega-3s have a combination of 2 fatty acids, 2 main fatty acids, DHA and EPA. They stand for long words, but 60% of your brain is made up of DHA. So obviously supplementing that helps out. Obviously in Alzheimer's you have deterioration and shrinkage of the brain, so that helps out. This Clarity Support, it actually has a prescription item. It's got the same ingredient as one of them I mentioned earlier on the acetylcholinesterase. It's got galantamine in a low dose, but it also has your omega-3 acids in it too. I have my parents on Clarity Support, the Superior Omega-3, and the Vibrant Minds. Dad's been on this Clarity Support for a year, and like I said, I just told y'all a while ago that his doctor was just ecstatic. He hadn't had a checkup in 6 months, and he tested really good today with her. And usually he comes away from those, because, you know, mom's got to leave the room when she's evaluating him, and he usually comes out so mad that he just goes straight to the car and won't speak to mom, because, you know, he doesn't like the fact he can't answer simple questions, especially when it comes to just draw me 3 o'clock on a circle, and that's really difficult for him. And here's somebody who has over 250 clocks in their house because they used to work on antique clocks all the time. So that's where he's at, but he had a great checkup today, so that's a good thing. Just to let you know, I mean, you know, all of these are multiple products, so they have multiple things in them. Even the Superior Omega-3's got multiple fatty acids in them, and they're all very valuable to help out. These would be the baseline that and when I make recommendations on nutritional supplements and diet, I don't throw, you know, 10 items at somebody, because if they have a reaction, which one did it? If they improved, then could 3 of them have made them improve and the rest of them's a waste? So these are, to me, the foundational products for someone with dementia, or somebody who, like me, forgets names and sees a little bit of degradation. And I've seen a recovery on Luciplex with that. I'm 55. I'd love to say I'm still young, but you know how quick 20 years goes by, and I'll be 75. So I'm trying to do stuff now. I've also got to drop a bunch of weight. So I'm picking on myself here, telling you, you know, when I was preaching to you a while ago about all the findings, there's plenty of improvements, and also staying regulated with my high blood pressure, all those good things. But I would really like to entertain any questions that any of you have. I said, I took it, and and I did all the study on it because, just to let you know, before COVID, that company hired me to help go around and promote their product. I was going to Georgia at the end of March 2020, and that got canceled. Everything got canceled. They sold the company. But anyway, I know a lot about that product, and I know a lot about all four of those. And here's something that I preach to every person, or I tell every person when I make recommendations on nutrition, nutritional supplements, is that, I stand behind the products that I recommend. So when you look behind me here, Mason's from Jacksonville, Florida, been in business since 1967. Windmill, been in business for over 50 years. Integrative Therapeutics, made in Green Bay, Wisconsin. They haven't raised their prices in 8 years. They have a little bit higher end products. And then even Nature's Truth. You'll see them in your CVSs, you'll see them, but they also have a division that caters straight to independent pharmacies. And it's like, when you talk to them, I mean, they're in your corner. They could care less. Their side, the independent pharmacy side, could care less about the chain, because they know that we'll take the time to talk with people. Like, they have a lot of products that are kind of rare that they don't even put a label on, but you can call them and see if they have that available, and they'll label it somehow for you and get it to you. Because again, and another thing, it's not required by any nutritional supplement company for them to be inspected by the FDA. None. Integrative therapy, there's over 650 assay tests that the FDA puts manufacturers through. Integrative Therapeutics does another 300 above what the FDA requires. The FDA inspects Mason Labs. They inspect Nature's Truth. They inspect Windmill Labs. So yes, you can go to Dollar General and you can go to other places, and I hope you trust, that they can tell you that they have vetted these products, because I have, and because I've got a license on the wall, and that means something, because if I give you frivolous information and it hurts you, you can come back on me. So that's why when I make recommendations, I'll try to stress to people, like this Superior Omega-3 fatty acids, it's $44.95. Pretty expensive, but you also are getting a superior product because they don't use the fishes that carry heavy metals. There are a lot of fish that they will harvest, the cheaper companies, that they're type of fish that just suck up any mercury, any kind of metal out there in the ocean. They not only use the healthier fish, the ones that don't take in all the heavy metals, but then they have processes to eliminate all heavy metals out of the product. So that is a huge difference when it comes to supplement recommendation. And I cannot stress that enough, because inevitably somebody will buy a Superior and then they'll go to wherever else and get it for $9.99, and they're not getting the same quality. It's just that. You on omega-3s, you're paying for the technology, you're paying for the quality. On coenzyme Q10, it's in every cell of the body. It works with your mitochondria to help the energy level. It's the battery of your cells working with the mitochondria. You can find CoQ10 for $5.99, or you can get quality that you know is good, and you can even get one that's the next step down in the metabolic pathway of it, to where it gets in your system even quicker. So you're paying again for quality. And like, you can pay, and again, I do carry them, your Centrum, Theragram M's, one-a-days, all of those. That's the cheapest way to make a vitamin. It's called amino acid chelation. When you go up in price on vitamins, well, first of all, those vitamins, what do you think your absorption rate is on them? 20 to 40%. So what it says on that label you're lucky to absorb 20 to 40% of it. When you go up in price on vitamins, and one thing I've seen I love is it used to be that you're plant-based, which I really like plant-based vitamins. It used to be they were really expensive, and now the competition has brought them down because they're the most absorbed. So it used to be, you'd had to pay way up there for them, and now, Alive is a commercially available product that's in all stores, including ours. But again, once you're going up in price on a multivitamin, you're going up in that quality and better absorption. Okay, any other questions? So on yours, I would definitely go with that, and I certainly would, recommend just having talks with your OBGYN about getting a Dex-1 to evaluate your bone density, because again, you need a baseline, because what happens 15, 20 years from now, you can see where you've gone to. And just to tell you about women, I mean, I love testing my female pharmacy students. We used to have just a scanning device. It was not a diagnostic device. But anyway, I would test the 23, 24, 25-year-old, and they'd always test osteopenic, like you're going into osteoporosis, and it scared them to death. Well, women put all their money in the bank on bone density to age 30. So they're below that. So it's kind of a trick to do that to them. But anyway, so at age 30, that's when you put all your money in the bank as far as your strongest bone density. Males are around 35, so they lose it a little bit less degrading, but 1 out of every 4 osteoporotic patients is male. But anyway, so just so it's a good learning tool as far as looking at the benefits of, if you were to test just a little bit towards osteopenic and you're going in that direction, you can do something about it. The different hormones, depending on what they want to do, or they may just select to say, okay, let's put you on a good bone food formula that's got calcium and collagen and boron, manganese, all the different elements that's in bone. So you can do something about it. So I definitely would want them to do that to you, just to make sure you're in the right direction there, especially if it ever runs in your family. So. It's a screening device, but it gives you a picture evaluating those 5 different aspects of memory that I talked about. But yes, it would be good in looking at that age group, but not only that, how about a football team? Yeah. So whenever somebody is concussed, they can use, yeah. Right, or certainly race car drivers and those type of things. You can get them to test on that, and it will show a difference. Because
I had done that years ago, and I wish Mom had done that, had taken it years ago as well.
But I will, Eddie Wilcox was talking to me about, talking to the school system about using that Cognivue on whatever players. I mean, I played college basketball up until my sophomore year at Brescia, and I remember not remembering a quarter or a half of a game because I got hit in the head, and I played, and I couldn't remember after the day after. And I asked somebody, did I play the whole time? So even in basketball, you get hit pretty hard. Any other questions? If you're interested on all those other 9, I personally feel it's misleading and a waste of time at this time, and that includes the ApoE4. And that's the most prevalent, and that's what everybody tests for. But the studies show you it is at best correlative. If you got one allele of the ApoE4, then 56% of the people have one allele. And he has 2, and only 11% of the people with Alzheimer's has that. So at this time, we don't have a definitive nice test other than, unfortunately, autopsies to tell and the diagnosis. However, that I really see promise in that p-tau217 by a reputable drug company, Eli Lilly. And at first I thought I didn't know what they were doing with it, but I did more research today, And that's where they really are trying to bring it to market for it to be a clinically relevant test, because they want it to go between all the different diversities of people and to be reproducible to where it's not doing what ApoE4 does. And yes, it's nice to get people's attention on memory decline and memory loss, because again, I really think if you polled 10 people just walking by out there, they would just tell you, well, I can't do anything about it, and you know, when I get 75 or 80, I'll find out. And that's just not true. And it's like tonight, you know, as I feel people should be concerned about this, you know, we should have a whole building full of people here, because it's that serious. I mean, none of us wants to end life that way. And we certainly don't like to see our loved ones that way. So anything that we can do, and just like my dad, gosh, you know, you don't know the alternative outcome. Other than the fact that I do have a good correlation with my dad. He's 11th out of 12 kids. His younger brother has Alzheimer's also, and he's much worse than my dad. Fidgets, restless all the time. Even sitting down to eat with him, he'll eat one bite and then just piddle with his food and tear it apart. And you know, he's 2 years younger than my dad. And then my dad's oldest brother, the first child, he had children that were actually older and at the same age as my dad. And that's my first cousin. He's in, he retired from the IRS, so he, you know, very intelligent man. But he's in a nursing home right now, doesn't know anything, can't take care of any aspect of his life. So I mean, there's, you know, God only knows that if I would have done nothing for my dad over the years, what would have happened? You know, I would love to, you know, and I did speak up to my aunt, my uncle who's younger than my dad, and tell her that, you know, I have a regimen that I have dad on, but you know, they're thinking bigger terms, like there's a drug coming on the market that's going to make this huge difference, instead of trying to look at nutritional needs that people with memory decline need. So.